I want to welcome Dr. Golla to the show right now. She's been patiently waiting. There she is. And don't you look stunning? You look absolutely beautiful. What's that about? A gorgeous pediatric neurologist. That's craziness. And wonderful to have you here. And thrilled to have. Let's talk a little bit first. Tell them about you. Tell our viewers about you and what it is that you do, because you're amazing.
Thank you, Shannon. Thanks again. This is my second time on the show. I was here sometime in August last year. I'm happy to be back here during the most critical period. My name is Sailaja Golla. I'm a pediatric neurologist, and I have an additional qualification in autism and neurodevelopmental disorders, and that's what I do. My clinics are filled with 70 to 80% of them are autism kids under 18 years. I do see some adults as well on the spectrum, but mostly it's kids.
And where are you located?
Dallas, Texas.
That's right. I knew it was someplace that I have been that I was like, oh, I'm gonna get to come and see you at some point. I was supposed to be there in January and my kid got the flu, so that did not happen. But sometime in the future, I'm gonna be there and have an opportunity to see you.
Yes,
I've lost all of my screens. So Dr. Golla, a very interesting time that we live in, and I can't get any of my documents to work, but I know that there are some very specific things that you wanted to talk to us about to help us with our kiddos right now with this COVID-19 emergency. What can you share with us?
This is a very critical period. A lot of questions. How do we deal with autism kids, specifically when the schools are closed, they're home, no access to much of therapies? And Shannon, you were just talking about ABA and emphasizing the importance. Yes, having a good therapist does play. A lot of our kids do get ABA like full time, especially the younger age group. And this is really tough, not just on autism community and the patients, but also on the caretakers. They're strongly affected. What do we do? How do we keep them in the routine? Because they're so much used to the routine, and how do we get through? But most importantly, I think I would like to cover from a medical perspective what we need to be aware or be extra cautious, specifically with kids and autism kids. One strong thing I recommend is hand washing, which is about 20 seconds. And I do tell my kids specifically, hey, how do we have them wash their hands for 20 seconds? They can sing a song like a happy birthday song or a twinkle twinkle song, and mom can sing with them. It's very important. And some of our kids have these odd repetitive behaviors like either flapping, spinning, or touching the face often. So it's very important to avoid that. I know we can't put gloves all the time, but if they can wash and sanitize their hands, and maybe on those kids who are used to having those stereotypes of face touching, maybe having gloves on them would be beneficial as well. I also want to stretch the fact that I know we are not able to see the kids face to face or access to providers face to face. But a lot of us, including doctors, therapists, have access to what is called as televisits. And I think the government just passed the rule that you could do interstate visits. So for example, I can see a kid from California through a televisit. Through the video conferencing, and the insurance will be covered and we can take care of it. So there is access to providers, not just within your state, but also throughout the country through this crisis.
And Dr. Golla, and I'm not saying it right. I say it Golla?
Golla, you got it perfect. That's good.
Okay. So to some extent, we had telehealth before. In some states and in some circumstances, but my understanding and along with what you were just saying is that the things that were preventing us from doing it widely, that a lot of those just have been waved out of the way now, right? So that there's more telehealth than ever before. So for instance, you were saying that you are able to talk to somebody in California. So if a parent is watching and saying, hey, wow, I've never had the opportunity to take advantage of this before, how would they contact you? What would they do to start telehealth with you during this time?
Yes, they just need to call my office and we'll help them set it up. They need to have access to internet or email, and if they don't have that, we can still do it via regular phone. So there's multiple avenues and multiple ways to do it, and most insurances, including Medicaid, is now covered, and there is no interstate restrictions at all.
That's pretty amazing. So what is the number for your office, if you don't mind my asking?
Yes, definitely. I work for Texas Institute for Neurological Disorders, and I will also share my website with you. And the number is, whenever you're ready, can I go ahead and?
You can go ahead and tell us.
Yes, it's 1-844 754 8463. Yeah, 754-8463.
8463.
844, and I'm just typing it in as well and sending it right over to you.
Okay, but I think I've got 844-754-8463. Is that correct?
8643.
8643. See, you can
Yes.
see I'm slightly dyslexic with numbers. Okay, I've got that written down. And hopefully, so again, 844-754-8643 for those of you who wanted to reach out to her during this time and to do telehealth. Telehealth is something that, you know, we just in the last couple of years have seen the rise of this, and it's been helping so many families that are in faraway areas. And more people were using this. Parents were finding this was a little bit easier to do some telehealth things because, you know, if you're at work and your child's at school and you're having to have an appointment that's necessary for your child and not having to drive, you know, it's been a really beneficial thing. But the fact that the groundwork had been laid for this emergency, it's now become the mode that we all are relying on. So take advantage of it. This is an opportunity where you couldn't last week in some states reach out to the doctor and have a discussion about pediatric neurology. Now you can. And so let's take just a couple of minutes to talk about like what kinds of things you treat and that, you know, and that might be helpful during this emergency.
Yes. So it's a little challenging. It is a little different from a face-to-face visit, but we could literally do most of the things we do on a face-to-face visit. So the family calls in, we set up an appointment, and hey, it could be a new patient or a follow-up for medications or whatnot. If it's follow-up, it's much easier. You know the kid from before, and you have established that rapport with them, and just adjusting the medications or ordering new tests, and it's as easy as that. But when it's a new child coming in for a new diagnosis or questions, it's a little more challenging, but it's not impossible at all. And the televisit is not just telephone, just to emphasize, it's a video audio visit. So you could see me and I could see the child, I could see the family in their home environment. So we'll basically be doing the same things we do in the clinic visit, like a thorough history, an exam, whatever we can. So I can observe the child walk, play with toys, and I do use some gadgets via video to check their tracking or eye contact or speech, ask them some questions, and it's almost equal to a video visit. And it's pretty thorough. It might be like an hour to 2 hours, depending on the complexity. That's the evaluation. Once the evaluation is done, we typically do some tests. For example, I do offer genetic testing in the clinic, which is not blood, which is done by a swab to look for causes of autism. And for that, with the corona crisis, we are sending out kits home to families who need it. So the mom or dad can just swab at home and just drop it in a FedEx location. So what I'm trying to say is we could do the blood work, the genetic testing, whatever is needed, as much as we can from a home setting and still take care of all the needs. So they do get appropriate care and therapies. And I also hear that a lot of ABA therapists, BCBS are trying to do some communication via tele. I know it's restricted, but something is still better than nothing. So we do have providers working, and I would definitely suggest families to stay home and not rush into the clinic or go to the hospital unless there is an emergency. You could do everything from medications to blood work, to talking to your doctor. And again, with this, there is more anxiety, more nervousness, not just to the kid, but also to the adults and caregivers taking care of them. But we are here to support you, and we are available even for weekend visits. Given the crisis, we know that parents are working. So I see kids on weekends, evenings, after hours, through this crisis to get through all of us as a team.
Wonderful. And so I love all of this advice. We all need to be making the commitment to stay home and to realize that there are things in place to help even, the beginnings of doing the swab test and all of that. You can do that from home. Are there any other piece of advice that you want us to be looking out for as we move along through this crisis? And is there anything we should be looking for in our kids, or to stay ahead of the curve, so to speak?
Yes. So I definitely stretch the point of prevention, as we do not have a treatment as of today. So prevention is the treatment, and this is something we can prevent. So I tell all my kids and adults 5 golden tips. Wash your hands, like we discussed. Social distancing, which is very important. Like last week, I had a kid, but how does a kid with autism understand the point of social distancing? He was licking all of us, licking his mom, and the tables in the clinic, and so on. So social distancing is very important. 6 feet is what they say. But there are a lot of things you can do while social distancing. You could walk in the park, walk with a dog. Make sure you clean the doorknobs, computers, cell phones, keyboards. These are some things kids with autism are highly fascinated towards. So you could you should probably make sure that we do repetitive cleaning of the doorknobs and whatever the kids get their hand on at home or a daycare. Again, it's quite challenging for parents who are working to take care of the kids at home. But there are, again, services available. Try to find a friend or another parent who can take care of their kid while they're at work. And I would not say it's as simple as a flu. I don't want us to panic either, because there's a huge panic going on among everyone that what's happening. So it's not as simple as flu. It's more dangerous. But as far as we take the preventions, we should be good. And this does not affect kids as seriously. There are maybe a couple of kids diagnosed throughout the country. And most of it is usually when they're immunosuppressed or have some kind of pre-existing condition. So kids can be carriers. They can pass it on to their grandparents or the other sick people, or the people who are more prone to that, like the immunocompressed. So I would be careful, but kids usually have very mild symptoms. So if you see a child has a cold or a cough or a mild fever, please call your doctor. Try avoid going to the emergency room. Call your doctor so they could advise you on where to go and how to get it tested, because kids can be what you call as oligosymptomatic, or very few symptoms compared to the adults or the older people.
Thank you so much for all of that advice. Unfortunately, we're out of time, but I want to make sure that we give everybody your phone number again at the clinic is 8643. I'm going to say it again. They're asking me to start my video. There we go. 844-754 8643. So 844-754-8643. Thank you so much for being with us. We've enjoyed having you back on the show.
Thank you. Thanks.
Thank you. Bye-bye.
Stay safe.
Yes, you too. Wonderful. Thank you. Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.